20, 22 years ago, if you came to see me with metastatic prostate cancer, I didn't have much of anything. Where now we have real treatment options. The science that's surrounding what's going on with all of us in the different facets of oncology, it's unbelievable. Cancer research saves lives, bottom line. And there's many ways you could do research. Research is laboratory bent discovery science research, getting to the root of why is this even happening. Research is understanding pathology better, being able to incorporate artificial intelligence and making us all work better, smarter, more collaboratively. Research is clinical trials. I've got a new drug. How do we get it from this point early in the development to an actual patient so we can make a difference? I hope for every cancer patient, they consider a clinical trial in their journey. It's how we can help pay it forward. It's how we can help drug development to get to the next generation drugs. Research can be advanced imaging. That's the cool stuff. We get to see all sorts of interesting pictures. Let's take PET scans. It exists as a tool, but the markers, the tracers that we put in a patient has evolved depending on which cancer. In prostate cancer specifically, there's been tracers developed, so we see where those areas are where the cancer is sitting, troubling the patient, etc. We have an incredible cancer center. We are an NCI-designated comprehensive cancer center. That is something that says we have a level of science that can sustain scientific programs, of which at Mayo Clinic we have 6. We coordinate not just the basic science, but clinical studies as well. We have an outward-facing effort on community engagement, and we have an outward-facing effort as well as internal efforts to shore up the next generation scientists by ensuring that we are focused on education. That next generation physician, scientist, leader, we have to make sure they know what's happening. And both departments, Mayo Clinic as well as the Cancer Center, are really committed to make sure that next generation group is there. Because we have to keep this going, can't stop. We'll only stop when cancer is cured.